My name's Randall Schultz. I'm an orthopedic surgeon, but I'm also a patient. I had my own knee replaced 4 years ago. Here are the top 5 things I hear people say that surprise them the most about their knee replacement. Number 1, yes, they do make noise. And I demonstrate for patients all the time. And it is normal to make noise. I tell them to worry if it doesn't. Now, there is an excessive amount that can be the sign of a problem, but the reason for that is the surface of the knee that we put on there. And by the way, we should call it a knee resurfacing, not a knee replacement. We're not removing the entire knee. We're putting a new metal surface with a piece of plastic in the middle. In most cases, we cement it to fix it to the bone. There has to be movement in that joint for you to have the ability to move the knee. If we put it in so tight, you wouldn't be able to move. You'd have stiffness. It wouldn't work very well. Particularly if you have the leg suspended, like sitting on the edge of a bed or a chair and you shake the foot a little bit, you will hear or sometimes feel a little bit of rattling in that metal and plastic. All right, let's come into an exam room. I'll show you the kind of noise a knee replacement can make, particularly when you have it suspended off of a table. I've still got the microphone right next to my knee. I will demonstrate for you. So that's a normal amount of noise in a knee replacement. Nothing to be alarmed about. And it's not painful. Initially, it can be quite disturbing to people, but you eventually don't even notice it anymore. I rarely hear that other people can hear it. The patients, particularly early on in their recovery, are often caught off guard by it. And I try to prepare them and warn them for it, that it's a normal phenomenon.